Hi, my name is Michaela McGuire,
And I'm Carrie Sapita.
and for our General Medicine Assignment 3, we had anaphylaxis.
Our main point of focus for anaphylaxis are: what is anaphylaxis? What are the signs and symptoms of anaphylaxis? How do we treat anaphylaxis? And how do we prevent anaphylaxis? Etiology of medical condition. Anaphylaxis is the allergic condition characterized by the onset of allergic symptoms that involve two or more organ systems. It is a severe, whole-body allergic reaction to a chemical that has become an allergen, such as a drug, food, or insect sting or bite.
I know my father experienced anaphylaxis when he was stung by a bee. His whole leg began to swell up and his throat began to close. Luckily, my mother was nearby with an EpiPen and administered it right away. Signs and symptoms involved with this condition. Tissues in different parts of the body release histamines, which are organic nitrogenous compounds involved in the local immune responses. The body also releases other substances. This can cause the airway to tighten and lead to other symptoms. Symptoms develop quickly, within seconds or minutes, and need to be monitored. Symptoms are as followed: abnormal high-pitched breathing, tightness of chest, difficulty breathing and or swallowing, dizziness, hives and itchiness that can show up in the form of a rash, nausea and or vomiting, the swelling of the face, eyes, or tongue, unconsciousness, and wheezing. Some symptoms may result in death if not treated immediately and properly.
Diagnostics and testing criteria for anaphylaxis. One test that you could run is to check for arrhythmia or abnormal heart rhythm. One should also check for pulmonary edema, which is fluid in the lungs, if the patient has hives or low blood pressure, mental confusion, or a rapid pulse. It also is easy to see if the patient has skin that is blue from lack of oxygen or pale from shock. One should also test for angioedema, which is swelling in the throat, which may be severe enough to block the airway, or swelling of the face, eyes, or tongue. One should check if the patient is weak or wheezing. And by doing this, one should check the person's ABCs, their airways, breathing, and circulation. If the person has medication with them, you should help them take it. If the person has medication but it's oral medication, you should not have the person take it in case they choke.
Treatment and management for anaphylaxis. Call 911 immediately when athlete is experiencing anaphylaxis. If allergy is from a bee sting, scrape the stinger off with something firm, such as a fingernail or a credit card. Tweezers will squeeze more venom out of the stinger into the patient. Help the person take or inject the medicine if they have it available. Once a person goes into anaphylaxis, they need to be injected with an epinephrine pen as soon as possible. After they are injected with the pen, either in the thigh or the arm, they need to be taken immediately to the hospital. Never inject a person with an epinephrine pen in the hand or the foot. Once at the hospital, they will receive standard interventions, which include a high flow of oxygen, cardiac monitoring, intravenous access, which is an IV with fluids. Non-life-threatening cases may be released from the hospital after observation for 4 to 6 hours. If not treated right away, anaphylaxis could lead to death. If someone had a potential to have anaphylaxis due to a known allergy, they should carry an EpiPen on them at all times to prevent anaphylaxis.
If a person experiences anaphylaxis, they may go into anaphylactic shock. In order to prevent anaphylactic shock, the athletic trainer should have the person lie flat and raise the person's feet about 12 inches or however high is comfortable. They should cover them with a coat or a blanket in order to help them keep warm. The athletic trainer should not assume that the allergy medicine will provide complete protection from anaphylaxis. The athletic trainer should also not place a pillow under a person's head if they are having trouble breathing, as this can block the airways. Prevention of anaphylaxis. The athletic trainer can prevent anaphylaxis by having details on sports members' allergies and known triggers of allergies. The athletic trainer should also have proper medication for allergies and make sure they are up to date. One common medication for allergies is Benadryl. The athletic trainer should also make the athletes aware of potential dangers around them that could trigger anaphylaxis, such as bees, pollen, dust, and the food around them. The athletic trainer can also inform coaches of the athlete's allergies. They should also establish an emergency action plan for anaphylaxis.
Return to play criteria and conditions for an athlete after having an anaphylaxis. The athlete will need to follow up with the primary care physician to obtain clearance in order to return to play. The athlete will need to gradually go back into hard activity. It'll need to be individualized to return with the guidance of a physician and an athletic trainer. There will need to be an insured EpiPen available on site where the athlete is playing, and it needs to not be expired, so the date must be checked. The athlete should see an allergy specialist 3 to 4 weeks after anaphylaxis has occurred in order to determine what specific thing triggered anaphylaxis. The athlete needs to ensure that there is medical identification on them, which shows what allergy they have discovered.
How anaphylaxis affects athletes. Anaphylaxis affects athletes because it forces them to be more aware of their surroundings and the allergens around them. One risk factor is that if an athlete has already experienced anaphylaxis once, their risk of having a serious reaction increases. Athletes who already have asthma or allergies are also at a greater risk of having anaphylaxis. Adolescents and young adults may also be at an increased risk of having a life-threatening allergic reaction triggered because of the inconsistent behaviors in avoiding known triggers, such as insects, food, and drugs. The elderly may also be at an increased risk of anaphylaxis because of accompanying disorders and medication used to treat these disorders. One of these disorders is heart disease. In addition, the elderly may also be at an increased risk of anaphylaxis if they are exposed to biting or stinging insects. Disorders that make the symptoms of anaphylaxis difficult to recognize are impaired vision, seizures, or depression. Medications or chemicals that make the symptoms of anaphylaxis difficult to recognize are antidepressants, sedatives, or alcohol. Disorders such as asthma, especially if severe or not controlled with medication, heart disease, high blood pressure, and cerebral vascular disease, which is a group of brain dysfunctions related to hypertension, which damages the blood vessel lining in the brain, also put the athlete at risk for anaphylaxis. Certain medications used in the treatment of heart disease, such as beta blockers, may block the medicinal benefits of epinephrine as well.
The etiology for exercise-induced anaphylaxis. Exercise-induced anaphylaxis is characterized by the development of severe allergic reactions from mild to strenuous activity. It is a rare disorder that has only been outlined in the past 30 years. It is likely that one of the mechanisms involved in exercise-induced anaphylaxis is mast cell degranulation, which is involved with anaphylaxis, wound healing, and defense against pathogens. Also, inflammatory mediator generation is involved in anaphylaxis, which is resulting from biochemical effects of exercise. Vigorous forms of physical activity, such as jogging, tennis, dancing, and bicycling, are common reasons for exercise-induced anaphylaxis. Physical activity most often associated with exercise-induced anaphylaxis is jogging. Patients commonly experience attacks for over 10 years before the disorder is diagnosed. The average amount of attacks per year is 14 per patient.
Exercise-induced anaphylaxis, signs and symptoms. There are 4 phases in the sequence of anaphylaxis attack: prodromal, early, fully established, and late. Prodromal symptoms include a feeling of fatigue, generalized warmth, and pruritus, which is itchiness of the scalp. The early phase features generalized urticaria. In a fully established attack, symptoms include choking, respiratory stridor, GI colic, nausea, and vomiting. Late symptoms include frontal headaches that persist for 24 to 72 hours.
Exercise-induced anaphylaxis management and treatment. Tests for exercise-induced anaphylaxis in pediatrics include baseline serum tryptase level and exercise challenging testing. Not always is anaphylaxis the same intensity, but pediatricians and doctors suggest that certain foods with high allergy rates, such as shellfish, wheat, and nuts, should be avoided before exercise. In food-induced anaphylaxis attacks, food was ingested 1 to 3 hours before exercise. Abstinence from these foods with a prescription of an auto-injector EpiPen can help reduce your anaphylaxis attack.
Thank you for watching our presentation for general medicine on anaphylaxis.
Here are some tips that you should remember when dealing with anaphylaxis. If someone goes into an anaphylactic attack, call 911 immediately. If there is an EpiPen nearby, administer it. Check for the ABCs: airway, breathing, and circulation. Make sure athletes avoid known allergens. Always remember to establish an emergency action plan for anaphylaxis. Make sure EpiPens are up to date and expiration dates are in the distance. Anaphylaxis is a very serious condition, whether from nuts, bees, or any other allergen, or from exercise. It is serious and could result in death for any athlete. It should be properly monitored, and the proper medication should always be carried by the athletic trainer. Make sure you stay up to date in your teachings for anaphylaxis in order to prevent any sad happenings.
Thanks for watching!